Okay, so I'm going to share my screen again and let's go. Okay, so I am going to hand over to Maria Drummond, who's our Senior Clinical Studies Officer for ENRICH, and she's going to take you through the next few slides. So, Maria.
Hi everyone, just want to start by saying I've got a chest infection at the moment, so my voice is a wee bit funny and I might need to take a wee drink every now and then to try and get through the presentation. So Helen, next slide. So today I'm just going to talk a little bit about everything to do with ENRICH, and I'll start with a brief introduction and then I'll go into a little bit more detail about what it is that we do through a SWOT analysis. So I'll discuss our strengths, weaknesses, opportunities and threats. Then I'll talk a little bit more generally about care home research and how we can support research studies. I'll talk a little bit about the studies that we're currently supporting, and then our research ready care home network, and I'll hand back to Helen to talk about Rich Voices, our PPI group. So next slide. So I'm not going to talk for the next few minutes. I'm going to let this fantastic video that our PPI group developed explain a little bit about what it is that we do.
Welcome to Wraith Manor. This is just one of over 1,000 care homes in Scotland who are leading the way in research, supported by ENRICH Scotland, enabling research in care homes. We promote and support research in partnership with care homes across the country. We're working together towards the goal of improving the lives of residents, their families, and the dedicated staff who care for them. Research plays a crucial role in identifying best practices and putting them into place to provide the best possible care. By understanding the unique needs of care home residents and staff, we can make informed decisions that lead to positive change.
It's just about improving the quality of the residents, the staff and the relatives' journey through care. Just making it more accessible for people, finding out what works, what doesn't work. But it's just about involving everybody.
I came here just after Christmas. I enjoyed it. I was looking forward to it to begin with, as my daughter got arranged. But it's been great.
I like it here. People are very friendly. Staff are good.
You get a laugh with them, and you get a laugh at us.
I think research is important for better quality of life of the residents, getting them to experience more things, getting relatives more involved, and finding out that residents like something that they didn't even know they were interested in. In my head, research in a care home would be just sitting, having a chat, having a cup of tea, having a cake.
Residents coming into here could be quite stressful, so you might want to know a bit of background about these residents, things they've done at home, their past hobbies, jobs that they used to do, little things that can help them settle into the care home as well.
The research I would like to see for the future is more around how we can make the transition from home to a care home setting a little bit better. To help us do research in care homes, it's just about communicating with us. We're very willing to take part in any research that you have going on. If we can help, we will.
As you can see, research in care homes is simple to take part in and makes positive change happen. There are opportunities for everyone, residents, families and staff. We at ENRICH Scotland will continue to work to make a lasting impact together.
Next slide, please, Helen. Yeah, so now I'm going to talk a little bit more in detail about what it is that we do and how we enable research in care homes through a SWOT analysis. Next slide, Helen. So first and foremost, our strength in enabling research in care homes is our team. We've got a team of clinical study officers that are based across Scotland and attached to health boards, and they act as a primary contact for our care home staff that are interested in research. And the reason that this is their primary responsibility is because it's evidence-based. Research tells us that research in care homes is more likely to be successful if care home staff have a point of contact that they can work with to build a relationship with. But obviously, building a relationship, it doesn't just come overnight. It has to be real, and the strength of the relationship means the strength of the study. So that's why the clinical study officers do what they do. We also have a fantastic PPI group, our Rich Voices group, so I think Helen will talk about them in a bit more detail later on. Next slide. So we obviously encounter some weaknesses in enabling research in care homes, and one of the biggest weaknesses is around governance. There's a lot of frameworks in place and governance around healthcare research, but it's not quite the same for social care research, and care homes aren't healthcare environments, they're social care environments. There are the right mechanisms in place, it can just be a wee bit more complicated and not quite so clear for social care research. So some of what we do is help to support researchers and funders to understand that the mechanisms are there. You just got to kind of work a bit harder, basically. And the next weakness that we've got is in capacity. It's not a universal experience, but it is an issue across the sector where care homes are struggling to recruit and retain staff. And that means that often care homes are left working to the standards that the Care Inspectorate and the policies and guidelines specify, and don't really have much capacity for anything above that. So part of what we do is to try and work with research teams to make sure that what they're asking of care home staff is really clear and concise. And then another weakness is around diversity. We're keen to promote remote and rural care homes to researchers, but we know that if a study involves a little bit more than a survey or a questionnaire, it can be quite challenging to visit those care homes. So we understand that remote and rural care homes, although they are really keen to be interested in research, they don't yet have equitable access to all the opportunities that research brings. Next slide. So part of what we do, or why we do what we do, is to bring the opportunities that research brings to as many care home staff, residents and relatives as possible. And one of the things that we hear about from staff who have been involved in studies, maybe testing an intervention or something similar like that, is that it's brought an opportunity to develop new knowledge and skills and access professionals that they wouldn't have otherwise had access to. For some methods, it's about participating in an interview or a focus group, and staff can find the opportunity to share their experiences quite therapeutic. It's good to feel like someone's listening to your experiences and your opinions. Whether a study research is about improving care, the pandemic highlighted is that the guidelines and protocols in place keep expected environment. A lot of research around improving those guidelines and protocols and the evidence that's available.
Maria, I don't know if everyone can hear you very well. Oh, you're kind of breaking up.
I can't either.
No.
It's all breaking up, Maria.
I don't know what to do. Well, I can. Try again. Yeah. Okay.
Yep, if you could. So sorry about this, everybody. Hopefully she gets back in.
I think we jinxed it earlier talking about technical issues.
I think we did, Hazel.
Can everyone hear me?
Oh, that's much better.
Is that much better? Okay, sorry. Will I just start from here then?
Yes, please.
Will I start from the start of the slide, or will I start from?
Start at the start of the slide, yeah.
Okay, so part of what we do, why we do what we do, is to bring the opportunities that research can offer to as many care homes as possible. And one of the biggest things that we hear about from care home staff who have been part of studies that are in relation to testing a new intervention is that it's been a great opportunity to develop new knowledge and skills and have access to professionals that they wouldn't have otherwise had access to. For some methods, whether it's an interview or a focus group, it's about sharing experiences, and care home staff can find it quite therapeutic to share their thoughts and opinions and experiences with a wider audience. And for most research, it's about improving care for the residents. So it's a great opportunity to be part of something that will lead towards big change for residents. And the COVID-19 pandemic highlighted that there's lots of guidelines and protocols that were in place that care home staff were expected to work within that weren't really suitable for working in a homely environment. So now there's lots of research that's related to influencing and informing future practice to ensure that the guidelines and protocols that are in place are fit for practice. Next slide, please. So we also encounter some threats towards enabling research in care homes. And one of the biggest threats we've got is repetition. Sometimes researchers rely on methods that are similar to methods used by NHS support teams and the Care Inspectorate. It feels like just filling out forms and handing over data, and it can be quite exhausting for care home staff to be asked to do this over and over again without really understanding what kind of change it's leading to. And that also ties into maintaining momentum. The research process can be quite lengthy, and if you're interested in supporting change and improvement, when there's options like quality improvement, and it can seem much faster, it can be more tempting to take part in things like that rather than research. And the pandemic, we're working with a sector that's going through a massive adjustment period in relation to staff and who's working in care homes, as well as resident demographics. So we're having to kind of ride the wave alongside the care home sector. And finally, our biggest threat is our funding. It's reviewed annually, and we kind of work as if it's going to be fine, but it is in the back of our head. We try to continue to build medium to long-term capacity building, but we can't ignore that that is definitely a threat to our team. Next slide. So I'll just talk a little bit more now about care home research in the UK and how we support research teams. So this slide is a list of all the universities that we've worked with. It's not an exhaustive list of all the universities in the UK that are carrying out care home research, but it is a list of the universities that know about us and have accessed our support. We are primarily interested in improving research infrastructure around care homes in Scotland, and that's why there's more Scottish research and Scottish universities that we've worked with. But as we move forward, we want to work more and more with English research teams too. Next slide. So now I'll talk a bit more about the research support process. When I first came into this post in May of 2021, we had just got funding, and we were primarily based off of the model of the ENRICH down in England, the NIHR ENRICH. They've been established since 2012, and most of the research that was coming through for us was from the NIHR ENRICH team. But now that we are a few years down the line, more and more research is coming through word of mouth and social media, as well as our events and networking. So once a research team we know about a research team that are interested in accessing our research ready care home network, we ask them to complete a pro forma. That pro forma is quite short. It just outlines what the study's about, what the ask is of us and what the ask is of the care home, as well as what's in it for the care home. And then we review that study and their ethics and all the different components of the study and make sure that we're happy to support it amongst the senior team. We then share the study information with our clinical study officers, who then disseminate the study to care home managers through email, sometimes visiting the care home, and is with our monthly newsletter. For some studies, we're actively involved in research delivery, so that might be supporting with a survey, going out to visit the care home, it could be interviews or focus groups. And then once the study's closed for recruitment and our research activities finished, we keep in touch with the research teams, and a big part of what we're trying to do is to share findings, to share events and publications that come from studies, so that care home staff can see the full picture and why they've participated in what they've done. Next slide, please. So I'm going to talk about one study in particular as a bit of a case study that I think demonstrates really well what all the different things that we can offer. So this was a collaboration with ourselves, Edinburgh Napier University, and it was funded by NHS Lothian. So we were hearing from care home managers who said they were having real trouble with recruiting and retaining staff. So what it was we interviewed 10 care home managers in Lothian. 9 were women and there was 1 man, aged between 33 and 62 years old with an average of 23 years experience. And we asked them about their recruitment and retention. We asked them about how they support staff members who have an intention to leave. And what we identified was that, oh, and I should also say that 4 of the care homes were in the private sector, 3 were voluntary and not-for-profit, and 3 were local authority care homes. So what we identified was that the cost of living crisis, Brexit and COVID individually were causing real trouble for care home managers to recruit and retain staff. But when you combine all 3 of these things at the same time, as is the case at the moment, it's created a perfect storm. So care home managers can understand and improve and take steps to improve their retention by looking upstream. And by that I mean back to the source, starting with interviews and induction, trying to improve these processes so that people understand the role that they're taking on and that the right person is in the right role. Care home managers have a responsibility to keep staff on board and afloat. Managers have to take responsibility for the overall working environment of the care home and the team relationships, provide opportunities for development and rewards for staff that hang about, and consider their management style and how approachable they are. They should also try and create a care home that feels like a community so that staff have a responsibility to their team and the residents. To reduce the churn, care home managers can facilitate practice-based opportunities, work collaboratively with their care workers, and we've all got responsibility to take collective action to improve care workers' pay and responsibility. So this project was a good example of our relationship with care home managers and our team of experienced registered nurses who can develop and deliver research. Next slide. So one of the things I've noticed since I came into this job was that research has like trends. There's like trends in research and there's like hot topics. So when I first started, the pandemic was the hot topic, and most of the studies that were coming out to care home staff were around the pandemic, and then things kind of moved on to palliative and end-of-life care. And right now I think what's happening is that researchers are realising that there was a burst of research activity because of the pandemic, and now they have to maintain that momentum. But it's about prioritising research interests for care home staff and finding out what's really important to them and what are they more likely to engage in. So that's why right now I think a lot of the research that's coming out is in relation to that. Next slide. So we realised that we'd had quite a lot of new research-ready care homes this year, and what we wanted to do was try and streamline how we communicate with them and streamline how we communicate with researchers and kind of match up care home staff and managers that have got specific interests with research teams with specific interests. So in September we sent out a survey to care homes and of our research-ready care homes. We've had 79 responses so far, so just under half. Just asked them like what are they interested in, and the kind of most popular topic is palliative and end-of-life care, and that's not unsurprising. The pandemic accelerated a shift towards people moving into care homes to receive palliative and end-of-life care, but also care home staff are really interested in activities and anything really to do with supporting people who live with dementia. Next slide. So I'll talk a little bit more now about the research-ready care homes that we've got in Scotland. We did have 269 registrations, but we've now got 2 more. And that equates to 26% of care homes in Scotland are now research ready. And just to compare that to England, so the NIHR ENRICH team have been going since 2012, and 7% of care homes in England are research ready. So we're really proud of the 26% that we've got. So one of the things that was really important to me when I came into post was my background's in district nursing and care home nursing, and primarily in the East End of Glasgow. So I knew that it was really important for care home staff and residents and relatives that are in areas of higher deprivation to be able to share their thoughts and experiences and to be part of research. So we've been striving to ensure that the care homes that are research ready are the care homes in more deprived areas are fairly represented. So on the right hand side of the screen is a breakdown of the care homes by their postcode and their Scottish Index of Multiple Deprivation score. So 1 is most deprived to 10 least deprived, and we've made fantastic progress in trying to have this fairly well balanced. And now what we want to do is replicate that progress in the remote and rural care homes. So on the left hand side of the screen is a breakdown of those research ready care homes by their urban rural score. 1 is the most urban to 8 most rural. So we really want to try and get that balance moving forward. Next slide. So this is a boring slide that I don't expect anyone to read, but what it is about is highlighting that highlighting that the studies that we first started to support back in 2021 are now starting to publish their findings. So what I did was I highlighted all the papers that have come out of, I listed all the papers that have come out of the studies that we've supported so far and highlighted the year. And what you'll see is that most, potentially all, I think, are 2022. Oh no, there's one 2021 there. Most are 2022 to 2023. So that just highlights that the research process is long, but you will eventually start to kind of see the benefits from it. And I think that's my presentation done, Helen. So now I'm going to hand back to Helen to talk a bit more about Rich Voices in our PPI group. Thank you.
Thank you, Maria. Okay, so Rich Voices, as I said at the start, stands for Research in Care Home Voices. So we've broken it down into 4 areas. So like many patient and public involvement groups, one of our primary aims is to review the types of research and research-related activities that care homes are being asked to participate in. And it's really important to us that we get as many voices as possible to look at the types of research that are coming in, and also to ensure that they're in a state that's fit for purpose for then being able to disseminate to care homes. Sometimes the language we're not exactly too sure what they're trying to achieve, so it's good for us to go in, have a look at that, and go back to the researcher to get clarity before it's sent out. We really want to share experiences, so we want to involve people living and working in care homes in research-related activities that are meaningful, and I think that's the thing for us now. It's the meaningful. There's lots of options of how care homes staff, residents, and their families can get involved in our Rich Voices, and it's by joining our core team who meet fortnightly on a Teams call to review the activities that we're being asked to get involved with, to be part of an interest register where you can get involved with the clinical studies officers that are in your local area, as well as just being on the mailing list so you get to know what's happening with Rich Voices across the year. One of our newest things that we're looking at is about accessible research, and Rosie and Anna, whose pictures are at the bottom of the screen, are developing an online platform whereby we can upload summaries of research which are in layman's language so that we can all understand it, and anything to do with research that we're involved with, such as films, podcast episodes, which are coming out towards the end of this year. So we're working with care home managers, or we're about to start working with care home managers and care home staff to build this online platform, and the meeting will be taking place, but the first meeting will be taking place shortly, and it will be ready for our conference that we're having in March. We will launch it all there. And as you got shown at the beginning of this webinar, we've created a film. So this was Rich Voices, along with the ENRICH clinical studies officers, to create a film about research in care homes to help raise awareness and increase confidence in talking about care home research. And we've put little QR codes at each of the headings. If you scan them, once I send you the presentation, it takes you straight through to either forms for joining Rich Voices, or for how researchers ask for patient and public involvement help, and also for our film as well. I think that's me. I'll hand back to Maria.
Yes, I just wanted to flag up that we've got a care home managers research forum. We started a couple of months ago, really as an opportunity to bring together care home managers who are particularly interested in research across Scotland. There wasn't really any sort of plan for the group. We're just kind of letting it naturally unfold. And one of the things at the last meeting, one of the suggestions made by one of the managers was that they would really like to hear about current research opportunities from the researchers themselves. They felt like it probably more likely to participate in things if they could meet the kind of face behind the name. So our next meeting is on the 29th of November. We've got 3 researchers from 2 studies coming along to talk a little bit about their studies and why they're doing what they do. So if you work in a care home and you're interested, if you email our email address at the bottom on the slide, then you'll get the link to come and attend. So yeah, I just wanted to flag that up. Really looking forward to it. And I think that's me, Helen. Yeah. So that's just our contact details. You'll find our website on the NHS Research Scotland website, our generic email address, and on social media we are ENRICH Scotland. So right now we're on Twitter and Facebook, or X and Facebook, and we're hoping to move into Instagram, and Emma even wants a TikTok, but I don't know if that'll ever happen. So yeah, you'll find us on social media as well. Thanks very much, everyone.
Okay, thank you very much, Maria. Obviously I couldn't see the chat when I was presenting. So whilst I have a quick read of the chat and see if there's anything. Is there anything? Nope, that's okay. Does anybody have any questions for Maria or any of the ENRICH Scotland team? Hazel.
Yeah, it's more sort of a curiosity. Just you were saying that all the staff are registered nurses. I was just wondering what your mix of like adult and mental health nurses were and stuff. Sort of how many mental health nurses you had.
So we've got 6 clinical study officers, and I think off the top of my head, Bernie and Leslie can keep me right. Most are mental health. I am adult and registered district nurse, and Leslie is both. Yeah.
And I'm both.
Oh, and Maureen both as well. Thanks, Maureen.
Am I right in thinking I should know the answer to this, considering it's my job? But
oh, brilliant! That's good to have that nice mix, because quite often it's
to be a
CSO
in the network,
yeah,
you don't
cool.
necessarily have to be a registered nurse. So that was the same for a CSO for ENRICH, I'm quite sure.
Yeah, you don't necessarily have to be a registered nurse, but as it stands at the moment, we are all registered nurses, and we do all have experience. Yeah, we do all have experience either working in care homes directly, like myself. I've been a cleaner and a carer and a registered nurse in care homes, and Leslie's worked in older adult wards, and Bernie's worked in community nursing services as well, like myself as well. So yeah, all kind of mixed bag, but yeah, lots of experience working with care homes.
Thank you. Liz, would you like to say your question?
Yeah, first of all, I'd like to say thank you very much to, excuse me, all the speakers for a really, really interesting and informative talk. It was absolutely brilliant. I work in Tayside, so I work in the task office with respect to clinical research, clinical and healthcare research. And I've been working with, I don't know whether you know Irina McLean in the NRS, in the Chief Scientist Office with the NRS Central team. And we have been struggling, as you mentioned, about, the governance of social care research. And trying desperately to progress the governance. But I was also wondering with respect to what we call, I don't know whether you work with Accord, the Accord guidelines with respect to the attribution of the different budgets. Because I know that there has been concern with respect to social care and third sector research as to full funding of your research? I wonder, have you experienced issues with respect to that?
No, so most of the studies that come to us are either it's like academics and universities. So some of them come to us pre-funding and ask for letters of support or for scoping for care homes that might be interested in participating to support their application. But most come once they've got funding in place. So yeah, we've not necessarily encountered that yet.
And can I ask, do you expect then that, are you core funded as an organisation, as a group? Or if, for example, because we've worked with, say, Gavin, Gavin Wiley, the podiatrist, if he got a grant, would he be expected to inbuilt that funding for your ENRICH staff support in the research funding, in the application?
So we're funded by the Chief Scientist Office, and we are embedded in NHS Research Scotland. We don't. So if a study team's asking us to help deliver the study, we will ask them to cost our time before like within their funding application.
Okay, fantastic.
And for most of the research that comes along, it is focus groups and interviews or a survey or a questionnaire. So it's not like a big clinical trial where it's going to be lots and lots of time, although obviously we would be keen to work on something like that eventually. We ask them to cost our time, but if it's something like, if it's just sharing a study on our newsletter or it's or on our website, social media, we don't ask for any money for that, obviously.
Okay. And can I ask, have you ever had to turn down a study due to capacity?
No, so we did turn down a study where we've turned down one, and it's because we weren't happy with the ethics committee. So when we looked at their ethics approval letter, we identified some issues. It was just a bit too closely aligned with the funder and things like that. We went back to ask for extra clarity around that, and they weren't able to give us it. So we said that obviously carry on as they like, but we weren't confident enough to share it with our research ready care homes.
Okay, thanks very much for that.
Thank you. Does anybody have any other questions? Rosie, I can see you have joined us now, so can you just introduce yourself quickly?
So I'm Rosie. I am one of the co-leads for Rich Voices. Thank you for doing an excellent job describing it, Helen. I caught the end of it, which is always helpful. So yeah, I'm here for anything related to that, and trying to link in as much as we can with research that happens before it then comes to kind of Maria to go out to in practice participation.
Great, thanks, Rosie. Hazel, did you have your hand up there and put it back down again?
Yeah, I wasn't really sure if it was a question for here, but I was just wondering, I know ENRICH supports CHIP, and I know there's a member of CHIP here, and I was just wondering how the CHIPs are going, because I know Edinburgh had set one up, Glasgow had set one up. I was just wondering if anywhere else had or anything like that.
Maria, I'll hand over to you for that one.
Yeah, so we've got Cheryl from the Lothian CHIP. The Glasgow CHIP took a bit of a pause while I was on maternity leave, and we're starting to kind of feel that out again. And I think we have Janice on the call there. She's from the Glasgow CHIP. So yeah, we're just starting to kind of flesh out some ideas for possible future opportunities for the Glasgow CHIP. But the Lothian CHIP started in 2018, I think. Cheryl, is that right?
I think so.
Yeah. So yeah, I mean, do you want to share any of your experiences?
Yeah, it's the Care Home Innovation Partnership, for anyone who didn't know what the CHIP was. It's really care homes being able to inform, at this point now, research, but initially it was about developing tests for change and support, and through the pandemic that was absolutely invaluable. But it seems to have sort of moved on. So we had our first face-to-face meeting in about 3 years a couple of months ago, which was great. And again, it was really supporting and championing. Actually, we've done a cracking job. We're here. And where do we go from here? So there's quite a few different projects coming up. But again, it's more about sharing our experiences with ENRICH with other care homes. and also working out, what's the priorities for research that comes up. We also had a call with somebody who was really interested in developing it. And this is shocking because I can't remember where she's from, but somewhere in Scotland, somewhere further north in Scotland. So again, there is a real interest in developing this as sort of smaller groups to then perhaps feed more into ENRICH, but also to be able to kind of go the other way and to share what ENRICH is doing with other places as well.
Thank you, Cheryl.
We wondered if maybe the Care Home Managers Forum might become a chip, like a kind of national chip, but as I say, we're just kind of letting that develop in itself with the managers that are able to participate, see where it goes.
Brilliant. Thank you.
Okay, any other questions before we let you all go? Well, thank you so much for your time today. I'll send out the presentation and a copy of a link to the recording, and we will share it again on social media and on our website. So if you know of anybody that you think that might be interested, please do share it with them. Please follow us on X, Facebook and Instagram when we get on there as well. If you have any questions that you didn't want to ask us here today, feel free to get in touch either through my email that I sent the invite from or the generic inbox, and I will direct you to the right person. Okay, thank you so much.
Brilliant. Thank you all. Take care.
Bye.